Doctor.
Welcome back to Hello Doctor. We're talking type 2 diabetes with Shaleen, and as she self-confessed, not a poster child for diabetes, but I laud the fact that you talk about it and you get it out there, and I think that's exactly what we want to do today. So
thanks, and I also want people out there to know that they mustn't be scared to talk about it.
Exactly.
Rather talk than be killed silently. Hello.
True. Yeah. Julian, great to have you with us as well.
Thanks, Michael.
Who's at risk for getting type 2 diabetes?
Many people, Michael. Generally, as you get older, you get a high risk for diabetes, but particularly patients that are overweight, that are inactive and lead inactive lifestyles, and patients with a family history, so mom, dad, brother or sister with diabetes, pregnant women who've had diabetes in a previous pregnancy, and patients with cardiovascular disease like blood pressure, they are at risk.
So Shaleen mentioned earlier, stressful lifestyle, 2 litres of Coke at night.
Yeah,
I mean, would you say those are the causes? Was it a lifestyle-initiated disease?
Lifestyle is probably the main cause. You do have a genetic predisposition in many patients, but lifestyle is the big issue that we try to address to try and limit the spread of this condition.
What about complications? Have you got complications, Shaleen?
Lots.
Such as?
Urinate all the time, get perspiration when you eat the wrong stuff, which I don't really get anymore because my food habits are not so bad anymore, and sleepiness. Woo! In the middle of nowhere, doze off. And that's not because of late nights, it's because of the sugar, because you're that's the symptoms that I experience the most. And of course, sore feet. Oh, here my voete raak so seer.
And eyesight? I mean, eyes generally...
Yes, that's why you see me wearing glasses, and I cannot have my eyes tested when the pupiltjies is nou nie reg nie, because I have sugar. So I do need glasses. And for the first time I thought it was bad lighting. Hello, it is my eyes. Also caused.
So tell me about those complications. I mean, people don't realise that there are serious complications in side effects.
I mean, the very big complications that of cardiovascular disease, heart disease and stroke. So patients that have got type 2 diabetes have got the same risk of having a heart attack as someone who's already had a heart attack. So those are high stakes.
So dit geweet?
Yeah.
Okay, so so you need to go and see the doctor soon. Also having high risk of stroke. Diabetes is the leading cause of blindness in the world.
Yes, I know that. I know,
and then effects on the kidneys, and it's also a leading cause of renal failure.
And thirst. Oh, jy bly dors,
symptoms of having.
And then it also damages the nerves in your body. So from giving you painful feet, Shaleen, even the sweating when you eat food is a sign of damage to your nerves.
Okay, but Julian, that happens, sorry Shaleen, that happens if it's uncontrolled. Correct. If you control diabetes,
you can avoid
it shouldn't be a problem if you eat the right foods,
if you eat the right foods, and particularly if you change your lifestyle.
Tell us a bit about diet, because that's important. Lifestyle changes. In fact, just give us some hooks to hang on to, Julian. Lifestyle changes for diabetes.
Lifestyle changes essentially is the way you eat and exercise. Okay. And they did a study where they took patients who were at risk of getting diabetes, and just by changing the lifestyle, what they ate, and by getting them to exercise, they reduced the amount of patients that became diabetic by 58%. That's an enormous difference that you can make.
I'm in a bad place as far as my diabetes is concerned. Not so much for the eating. I'm a smoker. Hello, what's it maak of ek rookie? That's bad. I know that. I need to cut down. That I know. I also need to cut a lot of fat out of the diet. I'm not good with exercising. I've got this... What's that other thing that you walk? Treadmill. In my bedroom.
Oh, really? And
it is now hanging my clothes and everything else.
That's
and
a fantastic
I've got to go treadmill and look at the TV there, and it's too much effort. So let's not go there with a thing. But I do realize that I am in a bad space because I'm getting older, not younger. And I want everybody out there also to know that you don't have to die tomorrow. What I also find, Michael, is that men, and it's not a sexist thing, they're better diabetics than women ever are because they take care, they take note, they eat the right foods, they go to gym, they exercise. Here ons sit maar met die sigaret en stress oor môre se vet vlees.
Shaleen, you see, diabetes makes your body age prematurely. So if I could appeal to your vanity, it does.
Now you see, that motivates me.
If you could control your diabetes, you would age less fast.
Oh, all right. Then I must really pay attention. No, I'm serious. That kind of thing.
That is scary. How would you sum up diabetes in terms of just an approach to lifestyle, Julian? I mean, for people who are not yet diabetic and potentially at risk for.
I think people need to look to see if they are at risk. Look at their family histories. Look at at their body weight and look at what they're eating and if they're exercising. We've become a very, very sedentary society, and just watching TV can put you at risk. And you need to see your doctor. You need to go and have a look and have the test done, make sure you're diabetic. And I did a test on myself the other day, and I was nervous myself. It's a human thing that you kind of...
and it's not a test you want to do once and never again. No. I mean, you had it done twice, after Buckles bit you. So
my dad had diabetes, so I know that I'm at risk for diabetes. So I always tell patients, I'm not diabetic yet. And I always say that yet. And that yet is the word that motivates me.
That's correct.
And when my wife sees me doing sit-ups at 20 to 1 in the morning and says, what are you doing? I said, I'm doing my sit-ups. She says, you're crazy. I said, no, I'm trying not to get diabetes. It's an ongoing struggle. And what's important also is there is medication that can also reduce the risk of getting diabetes. So it's important to see the doctor.
That people can use.
That's not expensive.
Well, ultimately, I mean, it's education. It's being able to see this, understand, and know about this disease. So, I'm sure there are loads of questions and issues around diabetes that we haven't touched on yet, because Shaleen's here and it's so much fun to talk to her. But if you have any questions, please do go to hellodoctor.com. There are doctors online right now ready to give you an answer, because the first and most important step in dealing with any condition is to educate yourself about it. And the lesson continues as we now look at the uncomfortable subject of pain management.
Hello, doctor.